Our first guest today is Shelbourn Stevens, President of Novant Health Brunswick Medical Center. Well, welcome back to the show, Shelbourn. It's such a pleasure to have you.
Thank you, June. It's always great to be here with you.
Well, the last time you were here, we heard lots of good stuff, and I'm hoping for the same this time. But as a reminder, let our viewers know what your title is and a little bit about your background.
Great. I'm the president of Novant Health Brunswick Medical Center. I've been here now for 8 years locally. I've been with Novant Health. I'm going into my 25th year with the company. Started out years ago as a respiratory therapist and had a variety of roles up in Winston-Salem, and was the director there of cardiopulmonary services when I left, and then came down here to Brunswick and have loved the area and loved the people here.
Mm-hmm. It's a great place to live. We love it.
Absolutely.
Well, today we specifically wanted to have you here to celebrate our 5th year of doing HealthWatch. So it's our anniversary year. We're going to do some special things during these months. So we wanted to kind of have a snapshot of what's happened at the Brunswick Medical Center since the last time you were here. I know lots of things have changed. So let's talk a little bit about that.
A lot has changed. It's continually changing. And in that 5 years...
Well, your role's changed a lot.
My role has changed. 5 years ago when you started this show, I was working with our ambulatory markets,
right.
Outpatient centers and surgery centers and imaging centers. And then shortly after that, I became the senior director of operations with the facility and really began to lead the building of the hospital and working with Denise on that as she was the president then. And then
yes, we had Denise on the show many times.
Yes, and then 2 years ago when she left and moved to Winston with Novant Health, I took over as the president of the medical center, and it's been so much fun in the last 2 years.
I'm
it's
sure.
A great team there. The staff and physicians are just remarkable, and seen lots of growth.
Well, you bring up the hospital, and that's a major accomplishment in the last 5 years here in Brunswick County. Let's talk a little bit about that facility. What makes that so unique and so special?
It's just a gorgeous facility to begin with. We have lots of space. We have all private rooms that are very large. They all have day beds in them for the guest. They have private bathrooms with nice large showers. A lot of the people really don't want to leave when it's discharge time. They want to stay. They have their dining on call.
Yeah, food's pretty good too.
The food is great, but you can call and order what you want according to your diet.
And when you want it.
And they'll deliver it when you want it. And it's just, we get the best feedback from our patients and their family members. It's just awesome. And the facility itself, like I said, was large. The hallways are large, so there's not clutter in the hallways.
Right.
And our environmental services staff and engineering staff do a great job.
Your floors shine. I have to tell you that.
They do. They do a great job keeping that facility really, really looking good.
Well, how about technology?
We've added a lot. Recently was the patient education channel that is both in English and in Spanish.
Right, we had Stephanie on talking about that.
Yes, and that has been a huge hit with the patients and their families. Just they can watch it when they want to. There's a variety of topics on there, especially for our Hispanic-speaking population. We don't have a lot of folks who can speak Spanish fluently. We do have interpreters, but being able to watch those educational channels in your native language is very important.
That's great. I never even thought about that.
We've also added robotic surgery, the Da Vinci.
Woo.
Our urologist and OBGYN surgeons, and we have one general surgeon who recently was trained in that, and they all do a remarkable job. And as people surf on the internet, they read about these new technologies, and they come asking for that, so we are able to present that there.
Actually, the new urologist is going to be on the show today after you, so he'll be talking about the robotics.
Great.
That's great. Well, I know that during the last year, Novant Health went through a branding change. And so it's a sea of purple everywhere, as though I think you call it aubergine. Is that correct?
Aubergine is correct.
Let's talk about that brand change a little bit. And how did that affect Novant Health Brunswick Medical Center?
It really put all of our facilities and our physicians' clinics under one brand name. Before, we all had separate individual names, and no one knew that one hospital was part of Novant Health and the one down the street was. So it really puts all of our facilities and our clinics under one brand name of Novant Health. And aubergine is a broad color that no one else has taken on, and it really stands out. And we hear lots of compliments around the new brand. And with that came the brand promise.
Yeah, let's talk about that.
We're going to deliver a remarkable health care when and where you need it and make it convenient for you with world-class technology. And I think we've really done that, especially with the new medical center.
Yeah, that has been, it's so striking, that color. Typically you see blue, green, red maybe, but that aubergine really stands out. And I know when I go to events, and you're so recognizable because it's a sea of purple, as everyone says, but a sea of aubergine. So I think that's great. Let's talk a little bit about the Novant Health Medical Group. I know that the practices have grown immensely over the past 5 years. I know we've added lots of physicians in our area. So tell us a little bit about that.
We've added a lot of specialists with our surgeons, our OBGYN physicians, the urologists, but when I go out in the community to speak to groups, the one thing I hear is we need more primary care. We need a lot more primary care, and we have been able to deliver on that since we've opened up the medical center. Physicians want to come to the area. They're learning more and more about it. We have a state-of-the-art facility for their patients to go to, and our physician recruitment has just increased tremendously.
Really?
We had a lot of people move into new clinics.
Yeah, I just realized there were some new signage up on some buildings that I hadn't realized they'd moved.
Yeah, Oceanside Family Medicine and Convenient Care in Charlotte moved into a new building a couple of years ago. Right. Great state-of-the-art facility with the numerous providers there. And
there are a lot there.
Their convenient care hours on the weekends. And then we recently opened up Oceanside Family Medicine in Southport with Dr. John Moore. And he has 2 new partners coming on by around October. They'll both be here. And they're females, which has been a big need. And then we have Oceanside Family Medicine in Bolivia with Dr. Hamby that has opened up, and he has Dr. Asbury that's joining him later this fall as well. So we've seen significant growth, and we're really meeting that need of primary care providers to the community.
Yes, when I'm out in the community and in events, I'm often asked about primary care because there just seems to be a lack of primary care in this area. Yeah. So I'm happy to hear that recruitment is going so well.
And we've even already signed one for next summer to come to the south end of the county near Calabash next summer. So recruitment is not as a struggle as it was many years ago. It's very easy now. We can be very selective.
Wow, that's great that you can be selective and get the quality that you're looking for.
Absolutely.
Yeah. Well, I know that we did talk about technology a little bit, but somebody said something to me the other day about an iris scan.
Yeah, we implemented that several months ago. So if you've been to our facility for the first time, they'll scan your iris. And then your next visit, they just scan you again, and all of your information comes up in the computer system for the folks there. So you don't have to spend a lot of time regurging all of that information with your name and your address and telephone numbers. We have you look at the screen and just make sure it's all correct. So it's much more efficient for patients.
Along with the lines of information technology and what have you, I heard that you're getting a new electronic medical record in the hospital. Is that correct?
That is correct. We call it Dimensions, but most of the world knows it as Epic.
Epic?
It is a true electronic medical record. There'll be computers in every room, and it's just going to give the staff more time at the bedside with the patients where they should be. And it's just a great resource. We've already started the planning, and it goes live next summer.
Live in 15?
Yeah.
Wow, well that's awesome.
It is.
Tell me a little bit about what's going on in the community.
We're out in the community all the time. We in the past year, have had a large community wellness initiative where we've been going out doing screenings around obesity, high blood pressure, diabetes, and pre-diabetes testing, and just educating the community on these issues because they're out there and they're big, and we need to address them. And wellness is just a big focus for us out in the community.
Right. It's much better to keep people healthy and well than to treat it later.
Absolutely.
When they're sick. So those screenings are really, really valuable, and I think that's great. Well, what's in the future?
We never know. We're continuing to grow. Our physician recruitment is very important. The people in Brunswick County are utilizing the new medical center. They seem very happy with the service that we have there. So we've seen significant growth, and we just hope to continue to grow and provide those needs. And if there's people out there who want to hear more about us, we'd love to come talk to them and tell them about the service. They just need to give us a call and let us know.
Oh, that would be awesome. Yeah. Well, time has flown by. We're out of time now. As always, it was a pleasure, but thanks for celebrating with us. We're so happy that we've been with ATMC now for 5 years, and it's great having guests like you, and I look forward to seeing you again in year 6.
Me too. Look forward to it.
All right. Thanks a lot.